Hello, my name is Caterine Vélez. My topic is Idiopathic Pulmonary Fibrosis. Definition: Idiopathic Pulmonary Fibrosis (IPF) is a type of lung disease that causes scarring fibrosis of the lung for an unknown reason. Over time, the scar gets worse and becomes difficult to breathe in the lungs. Next video.
Idiopathic pulmonary fibrosis, or IPF, is a progressive and fatal form of chronic interstitial lung disease that eventually leads to the destruction of lung architecture and ultimately respiratory failure. The exact mechanisms by which IPF occurs remain unknown. Early hypotheses suggested that this devastating disease was caused by chronic inflammation that led to fibrosis. However, an increasingly favored hypothesis suggests that a still unidentified stimulus or stimuli produces repeated injury or insult to the alveolar epithelium, followed by an abnormal repair response that leads to unremitting fibrosis. Let's take a closer look. Despite the unknown etiology of IPF, several potential associated factors have been identified and include genetic predisposition, smoking, environmental dust exposure, gastroesophageal reflux disease, oxidants, and viral infections. The specific sequence by which the pathogenic mechanisms of IPF occur remain poorly understood, but are currently believed to begin with repeated injury to either the function or structure of alveolar epithelial cells. Once injured, the activated epithelial cells stimulate the release of several pro-fibrotic and inflammatory mediators, including transforming growth factor beta and tumor necrosis factor alpha. TNF-alpha and other cytokines mediate recruitment of inflammatory cells, while TGF-beta and other growth factors stimulate the migration and proliferation of fibroblasts, which begin deposition of collagen matrix to initiate the repair process. Growth factors are also believed to play a role in the emergence of myofibroblasts from resident cells. Over time, these cells organize into clusters known as fibroblastic foci, where they continue to deposit extracellular matrix. The healing process becomes uncontrolled and dysregulated as matrix accumulates and the fibrosis becomes established. The dynamic balance between matrix synthesis, degradation, and resorption may become imbalanced, further contributing to the fibrotic process. The injured epithelium is unable to restore itself and becomes vulnerable to apoptosis or programmed cell death. In addition, the now exposed underlying basement membrane becomes disrupted, allowing fibroblasts to infiltrate the alveolar space. Conversely, fibroblasts and myofibroblasts fail to undergo apoptosis, resulting in continuous alveolar invasion and deposition of matrix, contributing to further destruction of normal lung architecture. The disease becomes more extensive due to repeated injury, each at different stages of development throughout the lung. This explains the temporal heterogeneous pattern interspersed with healthy lung tissue and the gradually increasing accumulation of matrix, unremitting fibrosis, fibroblastic foci, and honeycomb cysts that are the hallmark features of idiopathic pulmonary fibrosis. However, as our understanding of the underlying mechanisms of IPF evolves, from that of a disease resulting from chronic inflammation to that of one due to recurrent epithelial cell injury and aberrant fibrotic processes, our treatment approaches are evolving too.
Application in medicine. Patients suffer from restriction of the air that enters their lungs, and at the same time, it makes it difficult for the carbon dioxide to escape, which causes difficulty in breathing. In some cases, the lack of oxygen generates a respiratory insufficiency that requires oxygen therapy. The presence of possible antinuclear antibody or rheumatoid factor appears in your exam, which indicated the presence of the disease. Next video.
Number 8. new medications for idiopathic pulmonary fibrosis.
The lungs are the only internal organs that are exposed to the external environment and are vulnerable to a variety of ailments. However, when it comes to idiopathic pulmonary fibrosis, or IPF, death is a certainty unless the lungs are replaced. Idiopathic pulmonary fibrosis is a progressive disease isolated to the lung that causes scarring, thickening, and damage to lung tissue. Currently, more than 80,000 American adults have idiopathic pulmonary fibrosis, and more than 30,000 new cases are diagnosed annually. Life expectancy after diagnosis is usually 3 to 5 years, with patients progressively getting worse, most often because of respiratory failure. There is a new hope for patients with IPF. 2 experimental drugs that have been proven in large international studies to significantly slow the progress of IPF were just approved this month by the FDA. 2 new drugs in 1 year. People with IPF will finally be able to breathe easier.
Pros and cons. IPF can affect people of all ages. It is related to MACE, pulmonary and cardiac disease. Gradual unitation weight loss. The patient may present with low-grade fever, fatigue, arthralgia and myalgia, winding and rotting of the tips of the finger or toes. There are medications that prevent idiopathic pulmonary fibrosis from advances. Next video.
This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. For many other videos related to emergency medicine and the care of its patients, please go to edxitvideo.com. This video is about idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis is scarring or thickening of the lungs without a known cause. As you can see in the diagram and on the lung section on the right of it, the airspace are increased in size and thinned out and brittle. No one knows what causes pulmonary fibrosis or why some people get it. It causes the lung to become scarred and stiffened. This stiffening may make it increasingly difficult to breathe. In some people, the disease gets worse quickly, over months to a few years. But other people have little worsening of the disease over time. The condition is believed to be the result of an inflammatory response to an unknown substance. Idiopathic means no cause can be found. Or, like how I like to say, we are idiots because we can't find what's wrong with you. The disease occurs most often in people between 50 and 70 years old. Symptoms include chest pain, cough, which is usually dry, decreased tolerance to activity, and shortness of breath during activity. Signs and tests. The healthcare provider will perform a physical exam and ask questions about your medical history. Your doctor will ask whether you have been exposed to asbestos or if you have ever been a smoker. Patients with idiopathic pulmonary fibrosis have abnormal breath sounds called crackles. Patients with advanced disease may have blue-colored skin or cyanosis, as shown in the picture of the bottom left. This can happen around the mouth or in the fingernails due to low oxygen. Examination of the finger and toes may show abnormal enlargement of the fingernail bases called clubbing, as shown in the bottom right picture. Tests can help diagnose idiopathic pulmonary fibrosis include a bronchoscopy, which is putting a very thin tube down your airway into your lung, or a CT scan or computed tomography of your chest. No known cures exist for idiopathic pulmonary fibrosis. Unfortunately, no medication has been shown to improve the outcome of patients with this condition. For some people, medications such as corticosteroids and cytotoxic drugs may help reduce swelling or inflammation in the
Issue in Ecuador. It occurs more frequently in middle-aged men. In Ecuador, there are no statistics regarding the manifestation of the FPI. Its pathogenesis is Unknown, although it is probably due to the effects of various factors such as genetic predisposition, environment, smoking, exposure to metal, dust, soot, silica, and lead. Activity related to livestock and agriculture as well as relative. Next video.
Yeah, name is, you can call me Ijaz Ali. I'm 59 years old. April or May end, I suppose. Suddenly I got pneumonia attack. So I was rushed to Alexandra Hospital. I was admitted. There, the doctor was confused. How come I'm having this breathing problem? Then I showed all the scans, the reports, everything from India. Then I was put to again a lot of scans, lot of X-rays, spirometric test. These are all the tests, spirometric test, 6-minute walking test there. That means they'll put a lot of wires in my body. They'll ask me to walk and various other tests. And it has been confirmed beyond doubt I have idiopathic pulmonary fibrosis. Mine is total collapse of this thing, and community may not understand this thing. Yes, the entire Singapore, totally 7 patients only. And all the 7 I was told in SGH, waiting for lung transplant. I am under number 1. Basically, I should be thankful to my wife, because she has understood. She's with me throughout the day, almost throughout the day. And in order to go and buy groceries, this, that, everything, she takes care of me in such a way that she arranges. Really, I'm emotional. She takes care of all the needs. She arranges everything. Then she rushes out. Immediately she'll come back. And almost every half an hour she will call me whether I'm okay or this or that, and she'll make sure that everything available at her reach. Takes me to the dining area. See that at least I eat something, because I can't eat. Sometimes the pain from upper chest to the throat will be too much. You can see can I show my tongue? You can see my tongue, it's become blackened. So you can't feel the taste. You can't feel whether it's hot or cold. So it will be like eating a brick. The food will not be tasty, whatever it is, but she used to be with me, support. More pain, she takes care of me in toilet, showering. Till she takes me to bed. I have given up. Honestly, I have given up that in my lifetime I'll be having a lung donor or I'll be having an operation. But she has got 1,000 times belief, trust in God. Life goes.
Conclusion. IPF is a serious disease that usually affects middle-aged and older adults. It varies from person to person. Some onset from some gradual onset life. Long IPF has not held yet. Many people die only about 3 to 5 years after diagnosis. The most common causes of death related to IPF is respiratory failure. Other causes of death include pulmonary hypertension, heart failure, pulmonary embolism, pneumonia, and lung cancer. Medicine can improve condition temporarily increase lifespan. Next video.
Hello, in this health sketch we want to talk to you about idiopathic pulmonary fibrosis, or IPF. The word idiopathic means the cause of the condition is unknown. Pulmonary means lungs and fibrosis means scarring. So IPF is a progressive, scarring lung condition, the cause of which is not known. And though the condition is not well known, it affects around 5 million people worldwide, and it usually occurs after the age of 50. While IPF has no known cause, it is thought that there may be certain triggers that cause the scarring process to begin, such as viral infections, smoking, and heartburn. It can also run in families. There's no known cure as yet, however, there are things that people with IPF can do to help themselves. So, how does IPF affect the lungs? First, let's see how the lungs work. When you breathe in, the air ends up in tiny air sacs called alveoli, where oxygen can move into the bloodstream and carbon dioxide gets taken out. In pulmonary fibrosis, scar tissue builds up over time around these air sacs, which makes it harder for oxygen to move into the body. This leaves you feeling more short of breath than usual. The main symptoms of this condition are breathlessness and a persistent dry cough, which both worsen over time, making daily activities harder. Tiredness, weakness, and weight loss may follow. Diagnosing IPF can be difficult as its symptoms are often similar to other more common lung conditions. However, if your doctor suspects IPF from your symptoms, you should be referred to a specialist for further investigations, such as breathing tests. A high-resolution CT scan, which takes very detailed images of the lungs, is used both for diagnosis and monitoring the condition. Another test involves passing a small camera through your nose or mouth and into your lungs to see what they look like or take a sample. This is called bronchoscopy. Another test involves a small operation under general anesthetic to take a small sample of tissue for analysis, which is called a lung biopsy. Pulmonary rehabilitation has also been shown to benefit people with IPF. This is a structured program of gentle exercises and education about your condition and how best to manage the symptoms. Physiotherapists and specialist nurses can show you techniques to reduce breathlessness. Oxygen therapy can be used if your body's oxygen levels become too low, perhaps needed only during physical activity, or maybe while at rest too. For example, by attending follow-up appointments, taking medication as prescribed, and being vaccinated against flu and pneumonia. Stopping smoking is very important, as smoking damages the lungs and worsens the symptoms of IPF. It's also good to stay physically active, and eating healthily can make a significant difference by ensuring your body gets the energy and nutrients it needs. In this health sketch, we've talked about idiopathic pulmonary fibrosis, the scarring process in the lungs, the resulting symptoms, and how to cope with the diagnosis and stay as healthy as possible. We hope this health sketch has been helpful to you and those around you. Health Sketch. Health for all to see.